The Delta variant continues its stronghold nationwide. And tonight, the CDC just strengthened its recommendation for pregnant women. Now it strongly recommends soon-to-be moms get vaccinated against the coronavirus. Good evening and thank you for joining us at 7:30. I'm Megan Schiller. The agency previously had said it was safe for expecting moms to get the vaccine. And now it's a firm warning to get the shot in the arm to protect both you and your baby. Joining me now live over Zoom is maternal fetal medicine physician Dr. Michael Aziz. Thank you for taking the time for us tonight.
My pleasure. Such an important topic.
What about this new data sparked the CDC to come out today and really urge pregnant women to get vaccinated?
Yes, well, for any medical intervention, we weigh the risks and the benefits. The risks of getting coronavirus in pregnancy, we're learning more and more every day. We're learning that your chance versus a mom who's having a baby for just a regular pregnancy without coronavirus has a 35 times higher chance of needing oxygen support, has a 17 times higher chance of death, a 15 times higher chance of getting a blood infection, and a 5 times higher chance of getting shock. Also renal failure and a cardiac event and a preterm birth. So it's very serious, the consequences of getting COVID during pregnancy. As far as the safety of the vaccine, we're getting more and more information. Now we have the information from more than 120,000 pregnant women in the United States showing that there's no increased risk of early pregnancy complications like fetal malformation or miscarriage, and there's no increase in regular later pregnancy complications like preterm birth, hypertension, diabetes, or stillbirth. So whenever something is safe and effective, we recommend it.
Why are there so many women right now in the ICU and in critical care in the UK? And what does that mean for us here in America?
It's very unfortunate. You know, having a baby should be the happiest moment of somebody's entire life. And for people to end up in the ICU, the most likely scenario is that they were unvaccinated.
Can you rate the scale of vaccine hesitancy doctors are seeing around here for pregnant moms?
It's very difficult because people have really dug in very hard now. And I have some patients who I talk to and I attempt to talk to about the coronavirus vaccine, and they're not even interested in being counseled about it because they have been told to distrust professionals, doctors, and public health experts.
What would you say to a mom or a hopeful mom, soon-to-be mom, who's sitting at home right now and on the fence?
Please go and get the COVID vaccine right away. Even in my hospital in West Penn, we've had multiple moms admitted with coronavirus in the recent history. And having a baby should be the happiest moment of your life. It should not be done in the ICU where you're having trouble breathing, where people are worried whether you're going to make it or not, and whether your baby will have a mother to care for him or her later on.
Do you think that the delay in terms of people trusting it that are pregnant is because we didn't have that clinical data at the onset?
Yeah, it was a multitude of factors. You know, it was really a toxic stew of politicization and underlying vaccine hesitancy, which was present before the pandemic started. Before the pandemic started, the WHO had listed vaccine hesitancy as one of the top 10 global threats to public health.
Dr. Michael Aziz, thank you, and thank you for sharing your insight on this new change out from the CDC today.
Tell everyone, come and get your COVID vaccine before you get pregnant, during pregnancy, or while breastfeeding. We're happy to see you.
Thank you, doctor.
My pleasure.